Well, good morning, Andy.
Good morning.
How are you?
Good.
I am Dr. Richard Rowe, and I am a behavioral health consultant for this hospital. You were referred to me by Dr. Shaw. I would like to be sure to understand what brings you here today and what you would like to accomplish today. Can you tell me why Dr. Shaw is referring you to me?
Dr. Shaw wants me to consider abstaining from alcohol. He tells me alcohol can be detrimental to my hypertension problem.
So Dr. Shaw believes alcohol may be harmful to your health, in particular your hypertension issue. What are the concerns and priorities you would like to discuss today?
Well, I'm not sure I want to totally abstain from alcohol. Alcohol has never really been a problem with me. I would rather cut down on alcohol first and see what happens from there.
That sounds reasonable. So what I'm hearing you say today is that you would prefer cutting down on alcohol consumption now and possibly think about total abstinence from alcohol in the future.
Yes.
So can you tell me, what are the advantages of having a couple of drinks?
Well, I mean, for one, I socialize with friends and work with colleagues. Drinking also helps me to relieve work-related stress, and alcohol also helps me sleep.
What are the disadvantages of drinking?
Well, drinking costs money, and that I could save or spend elsewhere per se. I do not always feel good when I also wake up the next morning. And lastly, I do not feel very motivated for the day.
So now can you tell me, what are the advantages of drinking less?
Well, I guess I will have extra money to save for other things. My girlfriend and I are saving for a down payment on a home. I wouldn't have the doctor looking over my shoulders and telling me all the time to cut back on alcohol, so that's another thing.
Okay. So give me your opinion about what the disadvantages of drinking less would be.
Well, I will need to give up those evening after work with my friends and coworkers. My family and girlfriend will be upset that I am spending too much money on drinking.
I see. So can you tell me what alcohol beverage you are drinking and how much?
I drink either 2 tall 16-ounce beers or 2 mixed drinks.
With all that you've just said to me, I would like to make several comments. Would it be okay if I give you further information or factors regarding alcohol consumption?
Yeah, sure.
Okay. So the National Institute of Alcohol Abuse and Alcoholism recommends that healthy men not consume more than 2 drinks per day or 14 drinks per week. A drink is defined as either 12 ounces of beer, 5 to 5.5 ounces of wine, or about 1.5 ounces of spirits or hard liquor. So the first comment I wanted to make in this regard is that drinking 2 16-ounce glasses of beer is slightly over the limitation of 2 drinks per day, according to the National Institute of Alcohol Abuse and Alcoholism. But it's not too bad. The other comment is that this limitation for daily drinking pertains to healthy men. So alcohol is known to raise blood pressure. This is probably the reason why the physician thought you and I ought to talk and develop a strategy together today. I also wanted to mention this. Alcohol may help with initial insomnia of getting to sleep. However, it's real clear that alcohol is well known to disturb the middle stage of insomnia. Additionally, if your sleep is disturbed, you will not get adequate rest and sleep. This disturbance in turn in your sleep will actually exacerbate feelings of stress that you had during the day. Okay. So when you drink in the evening, do you find yourself waking up in the middle of the night at all?
Yes, I do get up in the middle of the night.
Okay, so that could be, that could or could not be related to alcohol. Okay. So what are your thoughts after hearing all this information from me?
Well, I can see where drinking can cause me health issues. Yeah, I could.
So you sense that drinking may be causing you some health care issues.
Yes, exactly.
Okay. Let me go over this. Let me go over this for a moment. How important, after hearing all this information, is it for you to make this change to maybe consume less alcohol? On a scale of 1 to 10, where 1 indicates the importance to cutting down on alcohol and 10 indicates 100% importance to quit, how would you rate yourself right now?
I would probably rate myself as a 5.
Okay. So why didn't you rate yourself with a lower score?
Well, I can see the importance of watching my alcohol intake.
Okay. So what would it take to move you up to a higher score?
I would need to see other alternatives to drinking. I would need to see other ways I can relieve work-related stress and find other ways to sleep through the night.
Okay. So what would you like for your score to be?
A 10, of course. I would always like to be motivated towards good health and keeping my hypertension under control.
Okay. So how ready are you to change your drinking pattern and perhaps consider drinking less? On a scale of 1 to 10, where 1 indicates a lack of readiness to curtail your alcohol consumption and 10 indicating total readiness to cut down on alcohol consumption, where would you rate yourself?
I would rate myself at a 6. I'm ready to make changes or adjustments to reduce drinking every day.
Excellent. So why didn't you rate yourself with a lower score?
Well, I mean, a lower score would mean I am not ready to change.
So it sounds right now you're ready to make some changes today.
I would need to figure out a way to spend some time with my friends and colleagues where drinking was not the main attraction to getting together.
What would you like your score to be?
It would not take much. A little support from my family, friends, and girlfriend would improve my success for consuming less alcohol.
Okay. So what do you see as your priority right now?
It appears alcohol may not help me reduce stress and fall asleep as I originally thought. Alcohol is also a concern to me, or a concern to the physician, actually.
Okay. So can I work with you today to develop a doable program? You would, of course, be in control of any program developed today. I would support and also schedule you for follow-up appointments as needed. My primary concern is for you to be confident and motivated in self-managing your own healthcare needs, including reducing your consumption of alcohol.
Yeah, I would like to collaborate with you on any program to promote my health.
Okay. So let me summarize here. You realize alcohol may not be totally beneficial to you. Alcohol may not help with sleep or stress as you originally thought. You know the physician is advising you to cut back on alcohol consumption.
Yes.
So after hearing all this, how confident are you about making a change in your drinking? On a scale of 1 to 10, where 1 indicates no confidence to change your drinking pattern, to 10 indicating total confidence to reduce your alcohol consumption, where would you rate yourself?
I would rate myself at a 7.
Why didn't you rate yourself with a lower score?
I do not believe alcohol is a problem for me. I can reduce or stop drinking at any time.
Okay, so what would it take to move you to even a higher score?
I guess I would need to find other ways to socialize with friends and coworkers or meet friends and coworkers in another setting where alcohol is not served. I also think I could be self-disciplined and not drink, even if I have friends and coworkers who choose to do so.
So what would you like it to be, your overall score here and your confidence?
An 8 or 9. I'm confident I could drink less and even quit drinking altogether. I just need my motivation to match my confidence rating.
So how committed are you to making this change? On a scale of 1 to 10, where 1 indicates a indicates no commitment to cut down your alcohol, and 10 indicating a total commitment to cut down your alcohol. Where would you rate yourself?
I would give myself a rating of 7. After what we have discussed so far, I am more committed to the idea of cutting my alcohol intake.
So what would it take to move you up to a higher score?
I would like to further define all the issues surrounding my health, not just alcohol consumption.
What would you like your commitment number to be?
An 8 or 9. I see no reason for not wanting to live a healthy lifestyle.
Is there anything from your past that you would draw on to help with adjusting your drinking pattern?
Well, I used to exercise a lot, but when I started working and the stress increased, I started drinking every night after work. And to be honest, I lost the incentive and motivation to exercise.
So I'm hearing you say that stress at work and consuming alcohol at night sort of caused you to lose any motivation to exercise.
Mm-hmm. Yes.
Can you tell me about your previous exercise program?
Yeah, sure. I was enrolled in a local gym. I jogged several evenings every week, and I also cycled on the weekends.
Congratulations, you had a great program at one point.
Yes, thanks.
What do you think would happen if you restarted your exercise program?
Well, there is less of a chance that my blood pressure will rise, and I think there is the potential for reducing stress through exercise, and my sleeping might even improve.
Okay, so suppose you were willing to try to make this change with an exercise program. How would you succeed?
Well, I would need to talk this through with you. Off the top of my head, I'm not sure exactly how to proceed.
Well, may I make a suggestion? I believe I have a way for you and me to start collaborating and developing this plan.
Okay, yes. What's that suggestion?
Okay, so I would suggest that we use what I call a change plan worksheet.
Okay.
This will help you identify the change you want to make. The goals, the main goals are identified. Possible obstacles are also identified. A specific action plan is put in place, and then you list your supportive resources. What do you think of this proposal?
Yes, I think the worksheet will help me organize my thoughts and also identify the changes I want to make.
Okay, so what change do you specifically want to consider?
Reducing my alcohol consumption and developing an exercise program.
Okay, so what is your main goal in making this change?
Maybe find other alternatives for relieving work-related stress and improving my sleep hygiene.
Okay, so what are possible obstacles to making this change, and how would you handle them?
Well, my friends and coworker may not understand when I am missing an action from the after-work social gatherings, but I will tell them that I need to develop an exercise program and ask if any of them would like to join me.
So, what is your plan to accomplish your goals?
Well, I will start in the next 2 weeks, probably.
Okay. So, may I take a couple of moments here and advise you about how to get started with your goal of exercising?
Sure.
Okay. I would like for you to develop the change plan worksheet that you have in front of you right now with me right now. This worksheet will clarify what you want to change, focus on the goals in making this change. There's a specific plan of action, and then you can identify other people who might be supportive of your decision to reduce your alcohol consumption.
Okay.
And let's work together. Let's do this change plan right now.
Okay, sure.
Here's what I want to do. I want to take a few moments and develop the plan with you today. And then what will happen is you can take it home, and then from there you can see how it works, see how it progresses, and then get back to me. So
Okay.
then what will happen is I will follow up with you in 10 to 14 days, and we will see how you are doing. Can you tell me the change you want to consider right now, the major change?
Okay, well, I want to reduce my nights out drinking with friends and coworkers. I want to use exercise to reduce work-related stress and hopefully even sleep better.
Okay, so let me summarize again, because it seems like the same theme is coming through this whole interview with you today, Andy.
Okay.
So what you want to change is reducing your alcohol consumption and developing an exercise program to help you relax, relieve stress, and help you sleep better.
Yes.
Okay, so how do you plan to accomplish this goal?
I think I need to schedule time to accomplish my goals.
Okay, can I make one more suggestion?
Yes.
Okay. My recommendation is that you become very proactive. So I would start with organizing and scheduling your time. So the first questions I would have for you in developing your change sheet that you have in front of you would be, would you exercise before going out with your friends, or would you exercise after spending time with your friends? And if you exercise after socializing with your friends, are you going to drink, or are you going to drink less? And then lastly, are you considering avoiding the conflict altogether by simply cutting back on those days that you spend socializing with your friends?
Well, I'm thinking about going out with my friends Mondays, Wednesday, and Friday, and exercising on Tuesdays, Thursdays, Saturday, and Sundays.
Okay, so at this point, what is your specific action plan? What will you do in the next 10 to 14 days when we meet again?
I will renew my gym membership, and I will buy new running shoes and clothing, and put in place the new schedule for going out with friends.
Okay, so your action plan is renewing your gym membership, buying running shoes and clothing, and making a new schedule with your friends in the next 1 to 2 weeks.
Yes.
Okay. Are there any other reasons or values you have for making this decision to change your drinking habit?
I want to improve my health and begin to save more money for a down payment for my house.
So would you describe the need to save money as your future goal for spending less time with your friends and coworkers?
Yes.
So that's your real future value to getting into an exercise program and cutting down on alcohol, is to have better health and also to save money to make bigger contributions for a down payment on a house.
Yes.
Okay. Let's do this. Put this change plan that you've written out today and the specific actions into play in the next week or two. Let's meet in 10 to 14 days and discuss how your exercise program is going, how your friends receive your more limited time with them, and let's identify any new barriers that might present themselves.
Okay. Thank you.
Okay. So thank you for spending this 15 or 20 minutes with me today, Andy. Thank you.
All right. Appreciate it.